Gestational diabetes. If your doctor mentioned gestational diabetes to you, don't panic. In this video Full Body Health, going to show you what gestational diabetes is and how it can be managed, so that it doesn't have any adverse effects on the mother or baby. We give you some information about gestational diabetes, so that when your doctor tells you it's time for a glucose test, you're ready with all the facts. Gestational diabetes is a pregnancy complication that affects 5 to 10% of all pregnancies, and is the most common medical problem during pregnancy. There are ways to manage it so that your whole family will feel great. During pregnancy, hormones released by the placenta block insulin's ability to transfer glucose, sugar, from the mother's bloodstream into her baby's body, where it can be used as energy. If not managed properly, gestational diabetes increases the risk of complications for both mother and baby. Gestational diabetes is developed in mid or late pregnancy as a result of changing hormone levels that interfere with the action of insulin. Some women will have no signs or symptoms at all, while some may experience weight loss, frequent urination, extreme thirst, and increased hunger. Symptoms usually develop gradually, over weeks to months, before diagnosis, though they may also develop quickly. Gestational diabetes is diagnosed with a simple blood test during pregnancy and can be managed by changing diet or taking medication. Causes of gestational diabetes. Research is still being done on the exact causes of gestational diabetes, but it is believed that genetics, ethnicity, obesity, age, being over 25, previous history of GDM, stress, family history of diabetes in a first-degree relative, parent or sibling, are all risk factors for developing gestational diabetes. Gestational diabetes mellitus, GDM, is a disorder in which a hormone produced by the placenta stops the body from adequately using insulin. Insulin is made by the pancreas and helps the body use glucose for energy. When someone has GDM, the pancreas doesn't make enough insulin, or makes other hormones that prevent insulin from working properly. This causes blood glucose to rise high, enough to be diagnosed as gestational diabetes. High blood sugar levels can lead to high birth weight in babies and developmental problems down the line. Gestational diabetes usually occurs between the 24th to 28th week of pregnancy, though there have been cases reported as early as 16 weeks gestation up until birth. Diagnosis should be made no later than 6 weeks postpartum, so proper treatment can begin. The American Diabetes Association recommends women who have had gestational diabetes to be tested for type 2 diabetes after they have had at least one child. The risk of developing gestational diabetes, again in future pregnancies, is about 25 to 50%. Gestational diabetes symptoms. Gestational diabetes symptoms are typically the same as for type 1 and 2 diabetes, including excessive thirst, fatigue, frequent urination, growing, aching abdominal pain in the back or sides of stomach area, increased hunger, blurred vision, and weight loss, despite a healthy food intake. If not treated, gestational diabetes can lead to increased health problems for both the mother and baby if left untreated. Complications include preeclampsia, preterm delivery, birth injury, high birth weight, respiratory distress syndrome, hypoglycemia in the newborn, stillbirth, cesarean section, and a host of other problems. It is important that women with gestational diabetes that are diagnosed get proper care from a certified physician or midwife throughout their pregnancy. Pregnant mothers should also talk to their doctor before going on any diet or taking any supplement. Gestational diabetes often goes undiagnosed because many women have no early symptoms, can present differently in different pregnancies. Gestational diabetes diagnosed. Gestational diabetes is diagnosed with an oral glucose tolerance test between the 24th to 28th week of pregnancy, though a fasting sugar test may be done earlier if a woman has risk factors for gestational diabetes. Ways to prevent gestational diabetes. There is no known way to prevent gestational diabetes from developing, though it's been shown that maintaining a healthy weight before pregnancy, engaging in regular physical activity, and eating a balanced diet can help reduce some of the risks associated with gestational diabetes. Gestational diabetes is treated with changes in eating habits and physical activity, along with daily insulin injections, or other medications if necessary. As always, pregnant mothers should talk to their doctor about proper prenatal care specific for them while they are pregnant. If you have gestational diabetes, please like this video and share your thoughts in the comment section, and subscribe to Full Body Health for more health information. Thanks for watching.